Hello, this is Todney,
And Katie Beauvais.
and we did our presentation on Ataxic Dysarthria. Okay, so for the case history, our patient's name is Amy Brown. She is a 52-year-old wife and mother of 3. She's a retired high school English teacher. She has been diagnosed with multiple sclerosis for the past 3 years. Within the last year, the autoimmune disease has become more deteriorating, and Mrs. Smith reports that her ability to do a lot of physical activities as well as her speech has changed. Prior to her diagnosis, she was an avid reader and coach for our high school's varsity soccer team. Mrs. Brown has no prior history of hearing impairments or communication disorders. During the evaluation, she expresses that her speech is slurred and is difficult for people to understand at times. She also notes that her voice has changed and has become more harsh sounding. She describes herself as a social individual and would like to be able to be understood by her family and friends. The salient features of the neuroport shows that she has a previous diagnosis of multiple sclerosis for the past 3 years. Her MRI revealed lesions in the white matter of the cerebellum and spinal cord. Mrs. Brown was diagnosed with ataxic dysarthria, secondary to multiple sclerosis. Neurobehavioral characteristics include gross motor difficulties with walking, decreased muscle tone, slow range of motion, imprecise articulation, pitch and loudness are monotone, and a harsh vocal quality, as well as voice tremors, due to decreased tone of the laryngeal muscles.
During Mrs. Brown's motor speech exam, her appearance at rest was within normal limits and her facial features appeared symmetrical. When she was asked to pucker her lips, however, she showed a little bit of difficulty. She also had difficulty when she was asked to move her tongue laterally. This also included other physical movements of the oral cavity. The client expressed frustration at her slow rate of ability to do the tasks that she was asked to complete. The most apparent difficulty was when the client was asked to wiggle the tongue and purse the lips. The stress test during reading revealed excess and equal stress on syllables and the use of scanning speech for attempts to alleviate articulation errors. The client was observed also during conversational speech, as well as reading tasks. When we observed her during the conversational speech, her jaw movement was observed, and it was typical in direction, however slow. The lip movement was also observed during connected speech and appeared typical, however, it was also slow. A slight harshness was noted in the voice during observation. During the alternating motion rates, she was noticeably irregular and slow, and during repetition of multisyllabic words and phrases, Mrs. Brown also had articulation errors present, most notably distorted vowels and imprecise consonants. She also presented with prolonged phonemes and intervals. She also had a mono-pitch voice quality, and her breathing and speaking rhythm seemed mildly disturbed. The client was visibly exerting maximum effort to successfully formulate speech. Mrs. Brown presents with moderate ataxic dysarthria secondary to multiple sclerosis, characterized by irregular articulatory breakdowns, distorted vowels, harsh voice quality, prolonged intervals and phonemes, and mono-pitch quality. Intelligibility in conversation was moderately impaired, however, improved greatly when the client was self-monitoring her rate of speech. Our treatment will focus primarily on articulation and prosody. Articulation therapy will include intelligibility drills with phonetic placement for focus on the VC non-words, as well as therapy for respiration practices. Our client will focus on rhythm and rate of breathing to get enough breath support to sustain successful articulation, and respiration will also aim to improve voice quality. The prosody therapy will include the SLP using cued reading materials such as slashes and pointing to cue the rate at which the client should be reading aloud, and contrastive stress drills will be used to work on the client's equal and excess stress. And that's it. That's all we have. Thank you.
you.